program. The option makes sense only if the financing pencils out. That's why we've asked the California Healthcare Foundation, and they've agreed to have the basic health plan modeled to see if it works for both the state and for the basic health plan enrollees. We expect the results from the modeling around May or so, and hopefully it'll show such that we can move forward with the issue. Now, I know there has been some issues that you'll hear from several groups seeking amendments to the bill, who is to the right entity to administer this program. The truth is that I don't even know the answer. All I know is that we need to look at this. I'm willing to work with those who have some concerns, but here is the facts that we need to deal with. Ideally, the health insurance exchange should provide this benefit, and if we were to move it into, it should be the ideal situation. However, right now, Mr. MIB is set up to handle the applicants. It has a board in place. It has the ability to get contracts. It has a provider network. It currently uses and utilizes all of the patients that it administers. So there's an entity that we can work with at this time. If the modeling shows that this is going to be a cost-effective and a benefit to California residents, I will be opening to looking at whatever mechanism is the absolute best mechanism so that all of Californians can be best serviced. Maybe that may even mean to have the discussion to move healthy families as well as this program into the exchange. My staff is engaged in ongoing discussion with all the groups, and I would commit to continuing to discuss this as we await results from the modeling. I respectfully ask for your aye vote. I have some individuals here that would like to speak on behalf of the measure. Thank you, Mr. Chair.
Witnesses in support.
Thank you. Christy Weiss on behalf of the Local Health Plans of California. The Local Health Plans of California are nonprofit, community-based health plans which are serving many uninsured and low-income persons now. We believe that the option to establish a basic health plan in California is an exciting opportunity, something that should be explored. As Senator Hernandez said, there are many unanswered questions that we will need to work through as this bill moves forward, but we do believe this is a very valuable option to provide high-quality, low-cost insurance to folks who will be coming into the insurance market, and at the same time to be strengthening the safety net, which we've spent so many years here in California establishing. So we ask for your support.
Thank you. Other witnesses support?
Good afternoon. Trent Smith on behalf of various county organized health systems, including Health Plan of San Mateo, Partnership Health Plan, and Central California Alliance for Health. We are also Medi-Cal managed care plans in various parts of the state. We're supportive of the measure. Our clients aren't sure at this point whether they would participate in a plan like this, but they definitely think it's worth pursuing as an option that they might be willing to consider at a later date. Thank you.
Thank you. Other witnesses in support? Witnesses in opposition?
Tweeners.
Tweeners. Oh, yeah. Beth, you could start as a tweener.
Beth Capel on behalf of Health Access California. We've been very pleased to be working with the author and the sponsors and want to commend them for their openness to exploring this idea. Like them, we would like to see a basic health plan if it will mean better, lower cost sharing, better benefits for consumers, and better reimbursement for providers. Those are all good things that we're supportive of. We have, however, significant concerns about establishing this at Mr. MIB. It is not quite correct that these are the parents of the healthy families' children. These are adults, 133% of poverty to 200% of poverty, some of whom will be parents, some of whom will not be, and that creates a number of complications. This will shift away from the exchange between 1.25% of the people who would be enrolled in the exchange, substantially undermining the purchasing power of the exchange, and that is troubling to us. It also will shift the risk mix of the people enrolled in the exchange, and that is also troubling to us. The adults who are at 133% to 200% of poverty will get the greatest subsidy with the lowest cost sharing, whether they're in the exchange or in the basic health plan. So they will be the healthiest lives. So you will peel out of the exchange the healthiest lives, and that is troubling to us as well. And I would also turn it to my colleague Elizabeth Landsberg at Western Center. We do worry about the complications of having we're always going to be in a world of multiple payers under health reform. We will have public programs, we'll have employer-based coverage, we'll have individuals buying coverage. This adds another layer of complication. Thank you.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, and we too would like to thank the chair and the sponsor for bringing this forward. We think it is very important for California to look at the basic health plan option, particularly because it does offer the potential for lower cost sharing for a very low-income population. So we appreciate that we're looking at this seriously. We look forward to the modeling. We do want to make sure that the cost sharing works for consumers, and we also want to make sure that if we're adding a new layer of complexity for people at a new income level, that we set up a seamless system. We know that the 900,000 people in this income range have a lot of income volatility. Their income goes up and down. They're going to be eligible for Medi-Cal one month and eligible for the basic health plan the next month. So as we continue to explore how this would look, we need to make sure that we have the eligibility systems in place to move them seamlessly. In addition to the proposal to look at the exchange to administer this program, we also think it appropriate to look at the Department of Health Care Services, which currently administers the Medi-Cal Managed Care Program, already contracts with these same plans, and already serves this population. We look forward to continuing to work with you. Thank you.
Further witnesses? Opposition?
Yes.
You're a tweener. Go ahead, tweener. Okay. Third tweener, and then we'll go to opposition.
That's it. Gary Passmore with the Congress of California Seniors and speaking also as a member of the Board of Health Access. I think the last two witnesses have laid out for you some of the complexity of this matter. We are concerned from the consumer point of view that we create the simplest system possible in California for consumers, that we maximize all of the federal dollars and other dollars that could be available under these changes, and yet we are really concerned about undermining the discounts available, the advantages of having the largest risk pool possible in the exchange. So we share the concerns. I think we as a group will be working with the author and with other people here at the table, and I guess my position is that we would like to see this bill move forward and that there be continued work on it. Thanks.
Thank you. Witnesses opposition.
Hello, good afternoon. Melinda McLean on behalf of the Orange County Board of Supervisors. They literally just took an opposed position as of yesterday, and so we apologize to the senator for not being able to get those concerns over to you, but they are going to be submitting a formal letter outlining their concerns, but we at least wanted to be on record to inform you that they did take an approved position to oppose this measure. Thank you very much.
Thank you. Questions from the committee members? Senator Wolk moves the bill. This motion's to pass to approps. Secretary, please call the roll.
Senator Hernandez.
Senator Hernandez, would you like to
address
close?
some of the concerns and questions?
Absolutely.
If you don't mind, I'd just like to close. You know, I was drawn to this because I really believe, members, that this is good public policy to have another avenue for the working poor to be able to have access to health insurance at a lower cost with richer benefits. I understand that it's kind of a work in progress. I understand that we have the exchange right now, but the exchange is not existed. It's not existing. You have no one's hired anybody, so we don't know what the outcome is, even though ideally we'd like to see it flourish and do great things. On the flip side, where the Department of Health Services was mentioned, the reason why I can't go there is because there has to be a competitive bid process. And with a competitive bid process, under Medi-Cal only, they do not offer that. Currently, Mr. Mibb is the only entity that has the ability to at least start this program. And I'm just kind of thinking out loud that maybe we can even look at starting it here. Once the exchange gets up running and it's effective, we can move it and look into moving it into that entity. But I think what we need to make sure and understand is that we have the opportunity with this federal law is to allow the working poor to get a richer package at a lower premium with less out of cost. secure federal dollars, and potentially even draw some Medi-Cal patients into this to reduce the overall general fund. So I respectfully ask for your aye vote, Mr. Chair and members.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland. Strickland, no. Alquist. Alquist, aye. Anderson. Anderson, no. Blakesley. Blakesley, no. De Leon. De Leon, aye. DeSaulnier. DeSaulnier, aye. Rubio. Rubio, aye. Wolk. Wolk, aye.
That measures out 6-3. Thank you.
Okay, we're going to go back. We're going to lift the call. We have all the members present. We're going to start off with file item number 1. Hold on just a second. Okay. We're going to start off with file item number 1, SB 41. However, Senator Yee has agreed to consider a sunset provision, not a study. It was previously mentioned during the testimony. My understanding that you're okay with that?
What we're doing, because I talked to his staff, and what they agreed to was there's going to be a 3-year sunset with a study to follow to show whether it's having a crime impact.
And
we'll work out the details before the next committee.
You're okay with that?
You know what? If they're not, that's fine. Just switch me from an aye to a no.
So you're okay with that? Okay. So the senators agreed to it. So with that, with the understanding that we will take these amendments at the next committee, which is public safety, with the understanding that the chair has the option to pull that measure back, Secretary, call the absent members. And it is due pass to public safety.
Senator Alquist. Alquist, aye. Anderson. Aye. Anderson, aye. Blakesley. And Senator Rubio. I'm sorry. And Wolk. No. Okay.
One, two, three. Okay, the measure is 5-3. The measure is out. We're going to move on to item number 2, SB 161.
That was 5-0.
That was 5-0. We're going to call the absent members. Lift the call.
Senator Blakesley.
Item number 2, SB 161.
Blakesley, aye. De Leon. DeSaulnier.
De Leon, aye. De Leon was aye?
Oh, sorry. De Leon, aye. So it's 7-0.
Were you aye on that one? Not voting. Okay. So 8-0. 8. Okay, it's 7 with 1 not voting. 7-0. Due pass to rules. The measure is out. As amended. Due pass is amended to rules. Item number 3, SB 278. It is currently 8-0. There was an absent member. Senator Wolk, lift a call. Absent member.
Senator Wolk. Wolk, aye.
That's 9-0. Measures out. Item number 4, SB 289.
And 3-0.
That is currently 3-0. This is due pass to appropriations. Call the absent members.
Senator Alquist. Alquist, aye. Anderson. Aye. Anderson, aye. Blakesley. Aye. Blakesley, aye. De Leon. Aye. De Leon, aye. DeSaulnier. DeSaulnier. DeSaulnier, aye. Rubio. Rubio, aye. We've got 9-0.
The measure is 9-0. It is out. Item number 5, SB 408, due pass is amended to appropriations. It's on call, currently 4-2. Call the absent members.
Senator Alquist. Alquist, aye. Blakesley. No. Blakesley, no. De Leon. Aye. De Leon, aye.
The measure is 6-3. The measure is out. Item number 6, SB 482, due pass to environmental quality. It is currently 4-2. Call the absent members.
Senator Alquist. Alquist, aye. Blakesley. Blakesley, no. Senator Wolk. Wolk, aye.
6-3.
The measure is out. It's 6-3. Item number 7. Item number 7, SB 695, Hancock. The measure is 6-0. We have one absent. How many absent members? One absent member or two absent members. Lift a call if they want to add on.
Senator Alquist. Alquist, aye. DeSaulnier. DeSaulnier, aye. Blakesley. Blakesley, aye. That's 9-0.
The measure passes 9-0. It's out.
It's 4-0.
And that's number 9. Item number 9, SB 743, Emerson. It's due pass to appropriations. The current vote is 4-0. Call the absent members.
Senator Alquist. Alquist, aye. Blakesley. Aye. Blakesley, aye. De Leon. DeSaulnier. Aye. DeSaulnier, aye. Rubio. Rubio, aye. So 8-0.
It's 8-0. The measure is out. Item number 11, SB 818, Wolk.
Actually, number 10.
Or actually, we're item number 10, SB 799, Negrete McLeod. It's 7-0, but lift a call for the absent members to add on.
Senator Alquist. Senator Wolk. Wolk, aye. 8-0.
The measure passes. It's out, 8-0. Item number 11, SB 818, Wolk. It's due pass to appropriations. It's on call. It's 6-0. Call the absent members if they'd like to add on.
Senator Alquist. Alquist, aye. Blakesley. Aye. Blakesley, aye. DeSaulnier. Aye. DeSaulnier, aye. All right, we've got 9-0.
At 9-0, the measure is out. Item number 12, AB 113, Monning. It's currently on call with 6-0. Due pass to appropriations. Call the absent members.
Senator Blakesley.
Number 12.
Aye. Blakesley, aye. De Leon. Aye. De Leon, aye. Wolk. Aye. Wolk, aye. 9-0.
Measure is 9-0. It's out.
And we already did. So we're good.
Okay. Thank you very much. That concludes today's Senate hearing.